Welcome back to my channel, and if you are new to this space, you are also highly welcome. In this lecture, we'll be looking at the deep perineal pouch. The deep perineal pouch can also mean the urogenital diaphragm, and the reason behind this will be unfolded during the course of this lecture. The deep perineal pouch does not also present a true configuration of a pouch, and this will also be unfolding during the course of this lecture. So read on with me as I describe the general orientation of the deep perineal pouch and also the characteristics that it presents. The deep perineal pouch is an anatomical space that is located between the superior fascia of the urogenital diaphragm and also the inferior fascia of the urogenital diaphragm. Let's try and use this image up here for illustration. This is where we have the pelvic cavity, and we know that the pelvic cavity is inferiorly guided or limited by the pelvic floor or the pelvic diaphragm. And this is what is seen to be highlighted here in purple. And inferior to the pelvic floor, the pelvic diaphragm is where we have the perineum, and this is what is demarcated here at this inferior region. And we know that the perineum is further subdivided into two triangular spaces. And this demarcation is created at this point here that is highlighted here in dotted black. Anterior to this region, we have the anterior urogenital triangle, while posteriorly we have the posteriorly placed anal triangle. Within the anteriorly placed urogenital triangle is where we have the urogenital diaphragm, and this is what is demarcated here or highlighted here in green. So we have the urogenital diaphragm, which of course is also structurally made up of a number of muscles, just as what is presented by the pelvic floor or the pelvic diaphragm. So you have the urogenital diaphragm, just a corresponding named diaphragm that is located within the urogenital triangle. Remember that the perineum is further subdivided into the anteriorly placed urogenital triangle and posteriorly placed anal triangle. So it is within the anteriorly placed urogenital triangle that we have the placement of the urogenital diaphragm. And this is what is highlighted here in green. This urogenital diaphragm is inferiorly and also superiorly covered by a membrane. So we have superiorly, the urogenital diaphragm is lined by the superior fascia of the urogenital diaphragm. And this is what is highlighted here in yellow. While we have also an inferior fascia also lining the urogenital diaphragm along its inferior surface. And this is referred to as the inferior fascia of the urogenital diaphragm, just as the name implies. But specifically, the inferior fascia of the urogenital diaphragm can also be referred to as the perineal membrane. And this is what is seen to be highlighted here in red. So we have the anatomical space, of course, that is filled by the urogenital diaphragm, and this is what is referred to as the deep perineal pouch. And it is this region here that is harrowed here in black. And this is why we say that the deep perineal pouch is not a true pouch, because it is seen to be embedded or filled up with the muscles that make up the structural component of the urogenital diaphragm. And this is what is highlighted here in this point. So you have this thin space that is filled with urogenital diaphragm. So this is what is referred to as the deep perineal pouch. It is the deep perineal pouch also because it is located deep within the perineal space. And if you look more superficially or around this inferior region, where you have a space here created between the inferior lining of the urogenital diaphragm, which is the perineal membrane that is highlighted here in red, and also the cos fascia at this point, which is the deep membranous layer of the superficial fascia around this space. So around this region, we have the superficial perineal pouch. So you see that the superficial perineal pouch is more superficially placed within the perineal region, while you have the deep perineal pouch is deeply embedded within the perineal region. If you try to relate the alignment of the deep perineal pouch and also the superficial perineal pouch, you see that the deep perineal pouch does not present a true configuration of what a pouch represents. And you can also see that it translates to the urogenital diaphragm, because this space that is harrowed here in black, that is tagged the deep perineal pouch, is a space that is filled with the urogenital diaphragm. And this is what is highlighted here in this region. So we can literally say that the deep perineal pouch can also be the urogenital diaphragm. And if you look at the configuration or how its alignment is presented, you see that it does not show the true configuration of a pouch. And this is why we say that the deep perineal pouch does not present a true configuration of a pouch. If you try to use this lower image, this image shows the inferior view of the perineum. So if you look at the perineum from the inferior side, you see that anteriorly here we have the urogenital triangle, while posteriorly behind we have the anal triangle. I've put up a lecture on the urogenital triangle. If you've not checked that lecture, please kindly go and do so. In this anterior region is where we say we have the urogenital triangle, and it is within the space that we have the urogenital diaphragm that is seen to be taken as a deep perineal pouch. So within this anteriorly demarcated urogenital triangle, we have a number of muscles that we say come together to form the urogenital diaphragm, just as what we have in the pelvic diaphragm or the pelvic floor. We say that these structures, they are diaphragm, but they are structurally made up of a number of muscles, coming together to form this alignment. So for the urogenital diaphragm, structurally, you have two major muscles coming together to form the urogenital diaphragm. The first muscle is the deep transverse perineal muscle. This deep transverse perineal muscle is what is seen to be highlighted here in red. So you have these muscles running along this alignment. You have one on this side and you have another one on the other side. Then the second muscle that contributes to the formation of this urogenital diaphragm is the external urethral sphincter. And this is what is seen to be highlighted here in green. External urethral sphincter, it means the muscle that is seen to surround the opening of the urethra. So you see it around this space and you see the fibers finally inserted laterally. So this is how it runs along its course. So these two muscles are the major muscles that form the structural component of the urogenital diaphragm. We have the emergence of the sphincter uretrovaginalis, and this is what is said to be highlighted here in yellow. Sphincter uretrovaginalis is a subset of the external urethral sphincter, but specific to just the female. So you see this presentation just in female, and you have this sphincter uretrovaginalis running and connecting the urethra with the vagina. We know that the vagina is peculiar to the female, so we should know that this muscle is also peculiar to the female. But this muscle, the sphincter uretrovaginalis, is an emergence or a subset of the external urethral sphincter, and it is just seen in female. So you have it running and connecting the urethra with the vagina, and this is what is seen to be highlighted here in yellow. You also have another subset of the external urethral sphincter, which is referred to as the compressor urethrae, and this is what is highlighted here in purple. And this compressor urethrae is also peculiar to the female, and you see it running along the anterior border of the urethra. It is also an emergence or a subset from the external urethral sphincter. So all in all, in female, we say that we have four structural components of the urogenital diaphragm, which will include the deep transverse perineal muscle, the external urethral sphincter, the sphincter uretrovaginalis, and also the compressor urethrae. But for the male, we have just two, and this includes the deep transverse perineal muscle and also the external urethral sphincter. So it's good for us to be able to establish the distinct structural composition of the urogenital diaphragm in both the male and the female. So you have fibers of these muscles, coming together to form a pad or a limit around the anteriorly placed urogenital triangle. And around this space, you see that inferiorly, it is then covered by the inferior fascia of the urogenital diaphragm. Above, it is also covered by the superior fascia of the urogenital diaphragm. We cannot see the superior fascia of the urogenital diaphragm in this image. Remember, we said that this image here is an inferior view, but we can see the inferior fascia of the urogenital diaphragm. And this is also referred to as the perineal membrane. So this is where you have the perineal membrane here demarcated or highlighted here in white, and you see it covering the inferior surface of the urogenital diaphragm. And this is what is presented here in this image. So we now say that the deep perineal pouch is located between this fascia, which is the inferior fascia of the urogenital diaphragm, that is highlighted here in white, and also the superior fascia of the urogenital diaphragm, that is not seen in this image. So if you imagine this presentation, you see that the deep perineal pouch can also translate to the urogenital diaphragm. So it's good for us to be able to establish it and explain the detail behind this expression. If you also try to use this image here by the side, this is the pelvic cavity. And we know that the pelvic cavity is inferiorly limited or guided by the pelvic floor or the pelvic diaphragm. And this is what is harrowed at this point. Inferior to the pelvic floor, the pelvic diaphragm, is where we have the perineum, and this is what is carved out here in this region. We said that the perineum is further subdivided into the anteriorly placed urogenital triangle and posteriorly placed anal triangle. It is within the anteriorly placed urogenital triangle that we have the urogenital diaphragm, and this is what is harrowed at this point, which means that this image that is presented around this point is the anterior region of the perineum, and this is where, of course, we'll be having the urogenital triangle where the urogenital diaphragm will be placed. So this structure that is harrowed at this point is the urogenital diaphragm. We said that this diaphragm is superiorly limited or covered by the superior fascia of the urogenital diaphragm. This is what is seen to be harrowed here in black. And inferiorly, we have the inferior fascia of the urogenital diaphragm. This is what is also seen to be harrowed here in black. This inferior fascia of the urogenital diaphragm, we say that it can also be referred to as the perineal membrane. I've put up a lecture on the perineal membrane. If you've not checked that lecture up, please also kindly go and do so. So this region that is carved out here at this point is the deep perineal pouch, while more superficially we have the superficial perineal pouch that is highlighted here in green. So you can see that the deep perineal pouch is deeply placed within the perineum, while the superficial perineal pouch is superficially placed within the perineum. I will also be putting a lecture up on the superficial perineal pouch in a subsequent class. So let's drive through in establishing the boundaries of the deep perineal pouch. The deep perineal pouch, if you try to use this image by the side, the region or the structure that is highlighted here in green is the urogenital diaphragm. We said that the urogenital diaphragm is covered by the superior fascia of the urogenital diaphragm, and inferiorly it is covered by an inferior fascia of the urogenital diaphragm. We say that this is specifically referred to also as the perineal membrane. We say that in between these two fascia or covering is where we have this deep perineal pouch. This deep perineal pouch, anteriorly, it is seen to be closed. And this closeness is as a result of the union of the superior and also the inferior fascia of the urogenital diaphragm. And at this anterior part, there is a union or a connection between these two fasciae. And at this point is where they form this closure. So anteriorly, you have a closure of the deep perineal pouch. If you try to use this image at this inferior side, remember we said that the urogenital diaphragm is a collection of muscles that are seen to be limited to just the urogenital triangle, which is the urogenital triangle in the anterior part, and behind here is where we have the anal triangle. So within the anteriorly placed urogenital triangle, we have a number of muscles, which basically include the deep transverse perineal muscle and also the external urethral sphincter. We said that for the female, there are additional two muscles, which include the sphincter uretrovaginalis and also the compressor urethrae. These two muscles are also subsets of the external urethral sphincter. We've tried to highlight on these in our previous slide. So if you look at this configuration, you see strands of these muscles, coming together to form the urogenital diaphragm. And at this space here, you see that it is covered by the inferior fascia of the urogenital diaphragm, which can also be referred to as perineal membrane. We say that in the anterior region here, this inferior fascia will unite with the superior fascia of the urogenital diaphragm, and it's seen to form a thickening around this point. And this thickening can be referred to as transverse perineal ligament. So at this anterior part, apart from the union of the superior and the inferior fascia of the urogenital diaphragm, there's also further thickening around this space. And this is what is seen to be harrowed here in blue, and this is what is referred to as the transverse perineal ligament. So you see that anteriorly it is closed. So posteriorly, behind, also going back to this image by the side, posteriorly, there is also a fusion or a union between the superior and the inferior fascia of the urogenital diaphragm. So this is what is presented here at this posterior part. So you see that anteriorly it is closed, posteriorly it is also closed. So if you also try to go back to this lower image, this is where we have the posterior end of the deep perineal pouch. So at this posterior end here that is harrowed here in red, you also see that the superior and the inferior fascia of the urogenital diaphragm are seen to also unite. So there's going to be a form of closure around this posterior end too, as what is presented in the anterior end. So laterally, you see that on both lateral sides, the deep perineal pouch is seen to extend, and of course, is limited by the ischiopubic rami. So we have the ischiopubic ramus on one side, and you have another ischiopubic ramus on the other side. So you see that this pouch tends to extend, and of course is guided and limited by the ischiopubic rami on both sides. What this means, if you sum it all, is that the deep perineal pouch is a completely closed pouch. So when you try to compare the configuration of the deep perineal pouch with the superficial perineal pouch that we would be looking at in a subsequent lecture, you see that the deep perineal pouch is a completely closed pouch. You can see that we have tried to highlight the different boundaries that it creates around its anterior, posterior, and also the lateral ends. And this is where it's seen to present closures around this region. So let's drive further to look at the content of the deep perineal pouch. We know that the deep perineal pouch is what is carved out here in this region, but the major structural component of the deep perineal pouch are muscles. And these muscles, we say they are a collection of muscles that will come together to form the urogenital diaphragm. Remember when we started this lecture, we already highlighted that the deep perineal pouch can also be taken as the urogenital diaphragm. And we've tried to illustrate the reasons or the basis behind this presentation. If you look at this alignment here that is carved out here in red, you see that the bulk of the structural components of the deep perineal pouch is made up of muscles. And these muscles are majorly the structural components of the urogenital diaphragm. And this is what is seen to be highlighted here at this point. And the second structures are viscerals. So you have a number of organs also passing through the deep perineal pouch. And as they run through this course, they're also taken as a structural component of the deep perineal pouch. So you have a region of the urethra around this space, then you have glands also embedded within this region. Then the next structure that we have are neurovascular structures, and these include arteries and also nerves. So we'll be going through each of these component. So for this slide, we'll be relating the content of the deep perineal pouch in both the male and also in female. We know that there are peculiarities, especially around the pelvic region between the male and the female. It's because of the reproductive system. So for the male and the female, we'll be highlighting the different structures that are seen within the deep perineal pouch. We highlighted in our previous slides that we have muscles, and the muscles that are enclosed or embedded within the deep perineal pouch, we say that are muscles that form the structural component of the urogenital diaphragm. So the first muscle that we have that is common to both the male and the female is the deep transverse perineal muscle. And if you try to use this image up here, this is where we have the deep transverse perineal muscle here, highlighted in red. You have one on this side and you have another one on the other side. And this is the path by which they run. The second muscle that we have that also form the structural component of the deep perineal pouch is the external urethral sphincter. And this is what is highlighted here in green. We said that the external urethral sphincter is seen also in both the male and also the female. Then for the female, we have distinct muscular component, and this includes sphincter uretrovaginalis, which is highlighted here in yellow. Sphincter uretrovaginalis, we say that it is a subset of the external urethral sphincter, but it is peculiar to just the female. And just from mere breaking down the name, we know that this sphincter is seen to connect the urethra and also the vagina, of course, as an emergence or a subset of the external urethral sphincter. We also have the compressor urethrae, and this is what is highlighted here in purple, and you see it running across the anterior border of the urethra. This is also peculiar to the female. It's also a subset of the external urethral sphincter. So for the male, you have just the deep transverse perineal muscle and also the external urethral sphincter. While for the female, you have the deep transverse perineal muscle, you have the external urethral sphincter, and you also have the subsets of the external urethral sphincter, which include the sphincter uretrovaginalis and also the compressor urethrae. So these are the muscular components of the deep perineal pouch. So going further on the viscerals that are contained within the deep perineal pouch will include the urethra. But it is good for us to highlight the specific region of the urethra that will be seen to course through the deep perineal pouch. So if you try to use this lower image here, this is where we have the pelvic cavity. We know that within the pelvic cavity, we have the urinary bladder. The urinary bladder is a temporal storage site for urine after its production in the kidney. And when it is time for you to release the urine will be released through the urethra. So this is where we have the urethra here. Highlighted in blue, this urethra is seen as an emergence from the urinary bladder within the pelvic cavity, and you see it passing through the deep perineal pouch before it is able to finally be directed along the penis, where it will be released to the external environment. This urethra is also seen to pass through the deep perineal pouch also in female. But if you try to use this lower image more to describe the specific region of the urethra that is seen to course through the deep perineal pouch in male, this is where we say we have the pelvic cavity. And within the pelvic cavity, we have the urinary bladder. Inferior to the urinary bladder, we have the prostate gland. We say that the urine that is stored in the urinary bladder needs to run through the urethra before it is finally released to the outside. So the urethra is divided into subregions. If you look at the urinary bladder, just around the exit of the urinary bladder, you have a small region of the urethra that is referred to as the pre-prostatic urethra. And this is what is seen to be carried here at this point. It is pre-prostatic because it is the region of the urethra that is seen before the prostate gland. Then you have another region of the urethra that is seen to run through the prostate gland. And this is referred to as the prostatic urethra. It is the prostatic urethra because it is a region of the urethra that is seen to run through the prostate gland. Just after this region, you have the membranous urethra. And this is what is harrowed here in this point. So if you look at this presentation, remember we said that this is where we have the deep perineal pouch here, arrowed in blue. It means that it is the membranous region of the urethra in male that will be seen to pass through the deep perineal pouch. And this is why it is taken as the structural component of the deep perineal pouch. After the membranous urethra, the next region of the urethra you have in male is the spongy or the penile urethra. And this is the region of the urethra that you see running through the penis. And this is why it is so referred to as the penile urethra. So you see that we have specific subregions of the urethra. So specifically, it is the membranous urethra that is seen to course or pass through the deep perineal pouch. And it's good for us to note this in case we ask during examination. For the female, it is the proximal or the superior region of the urethra that is seen to course through or pass through the deep perineal pouch. In addition to the urethra in female, we have the vaginal canal. So the vagina is also seen to pass through the deep perineal pouch, and hence it is taken at its structural component. We know that at the posterior part of the urinary bladder in female, we have the uterus, and the uterus inferiorly becomes continuous as the vaginal canal. The vaginal canal, of course, is open to the outside, and it needs also to course through or pass through the deep perineal pouch. So you see that behind the opening of the urethra, you have the vaginal canal. So this is another structural component of the deep perineal pouch, but it is peculiar or specific to the female. Then another viscera that is seen within the deep perineal pouch is the bulbourethral gland. This is peculiar to just the male. The bulbourethral gland, if you try to use this lower image, this is what is highlighted here in yellow. And you see that this gland is located on both sides of the membranous urethra. So if we say that it is located on both sides, on the posterior lateral region of the membranous urethra, and we say that the membranous urethra is seen to pass through the deep perineal pouch. It means that this gland will also be taken as its structural component. So we see the bulbourethral gland, but specific to the male, What the bulbourethral glands do basically is to release the pre-ejaculate into the urethra. We know that the urethra, generally male, is not seen to only carry the semen. It is also seen to allow for the passage of the urine. So this bulbourethral gland is seen to release the pre-ejaculate before the ejaculate is released, so as to help cleanse and also neutralize the environment for the passage of the semen. So it is located at this point and also taken as part of the structural component of the deep perineal pouch. For the female counterpart of the bulbourethral gland is the Bertolin's gland. This gland is not located around this region. It is seen to be located in the superficial perineal pouch. And when we get to this aspect or region of lecture, we would be highlighting this gland. And that is why there are no glands located in the deep perineal pouch in female. So it's good for us to take note of this. So this is all about the viscera that are located within the deep perineal pouch. We've tried to highlight the muscular component. We've also tried to highlight the viscera that are contained within this space. Now going to the vessels. Also within the deep perineal pouch, we have a number of neurovascular structures. We have the internal pudendal artery. This is where we have the internal pudendal artery here, highlighted here in red. The internal pudendal artery is the branch from the internal iliac artery. We have this artery, the internal pudendal artery, and also a number of its branches within, also seen to run through the deep perineal pouch. We have this in male, we also have this presentation in female. So this is common to both the male and also the female. Then the nerve that we have around this space is the dorsal nerve of the penis in male and the dorsal nerve of the clitoris in female, emergence from the pudendal nerve. And we know that the pudendal nerve is a branch from the sacral plexus. So as you see it around this space, you see it coursing through or passing through the deep perineal pouch, and it is also taken as its structural component. So these are the structures that are seen to form the structural component of the deep perineal pouch. And we know that we've tried to divide them into the muscular component, the viscerals, and also the neurovascular structures. So thanks for watching this video. Let's continue to stay glued to this channel.